Well, good afternoon, and thank you for joining us. You've joined the CAF COVID Weekly Roundup. My name is Jason Belden. I'm the Director of Emergency Preparedness with CAF, and today is January 8th, 2021. Happy New Year, everybody. And look at that, I managed to do 2021, and I didn't leave 2020 in there so I got it right the first time I tried to write it, so that's good. Hopefully you guys had a few days off during the holiday season there, and you were able to get some rest and relaxation in. For most of us, it was a temporary reprieve, and we're back at it this week. Sadly, the surge within the state of California has not gotten particularly better. In some areas of California, it's significantly worse. We'll talk about some of those considerations and essentially what they mean for us downstream. We'll talk about, even though there wasn't any AFLs released specific to SNFs during the time from our last webinar, I didn't put a slide in here, but I want to talk a little bit about the crisis standards of care AFL that came out for the acute hospitals, which was AFL 2091, and we'll talk about how that applies to us during the current surge. So with that, let's get started for today. Hopefully we should be able to get through this fairly quickly today, guys, and get to some questions. Since we don't have a bunch of AFLs to really dive into, we're going to talk about best practices and some other stuff. All right, and as we jump through, we have our kind of standard introduction, the speaker's opinions, and in this case, it's just going to be myself. I have Patty and Deanne both have conflicts this afternoon. The speaker's opinions are our own opinions and not CAF's official position. This is a grant-funded program, and I have no financial conflicts. The intent of the webinars is to give you a situational report on what we see happening within the state, some forecasting, and best practices where we can identify those. All right, so first, I don't know if you guys had a chance to see this, but the public health emergency was extended. It was set to expire on January 21st. Those extensions of the public health emergency apply to all the waivers and things like that. So a 90-day extension from January 21st would have put the extension out to April 20th. We don't know anything past April 20th, but at least in the interim, we have an extension of our public health emergency, and I know we've received a number of calls asking about that. So there's a link to the press release, and so that's in place now, and that went into effect yesterday. All right, so let's just talk for a second about testing. I don't know if you guys have paid attention to the testing task force updates that they give during the CDPH calls throughout the week. But if you've noticed, those time frames are going up, and it's not counting, when they talk about the testing turnaround times, it's all tests everywhere. And so that includes PCR tests that are being done in an acute setting with very, very fast turnaround times. So it is, so when they talk about, the average turnaround time is 2 days, there are folks that are getting it much, much faster than that, and there are folks that are definitely waiting longer than the 2 days. And if that's the condition that you find yourself in, obviously we want to try to pivot to the point of care testing if we can. We know that the Abbott Buy Next Now cards are available through county MOOCs. I've spoken to a few county MOOCs that have them in stock, and I've talked to other county MOOCs who have no idea what it is. It's important to get in contact with your MOOC. And I know you listen to the CDPH calls, and we tend to talk about the MOOC as a magic bullet that has all these cache of supplies and staff and stuff. That's not really, that's not reality now. And we understand that, or at least CAF understands that, and we try to counsel CDPH that, there is a person that we can contact, but whether that person has anything is a whole nother story. So, and that goes not just beyond these Abbott cards, but that applies to staff and PPE and a whole bunch of other stuff. So But when it comes to ordering these resources, not just Abbott Now cards through the MOOC, you should call and get in touch with your MOOC program. I can't remember if I included that on the handouts here. Let's see. There is so if you look in the handouts, there is a MOOC contact list for every county in the state. And now it has the EMS administrator who's in charge of that program for your county listed as the contact person. That's probably not the person you need to contact unless you're in a really small county and you're on a first name basis with that person. Generally, that's going to be the administrator of the program. What you want to do is contact the folks that work within that program. There's generally a generic email address, and ask them if they're familiar with the Abbott Now products, and could you order some of the cards. And these are, from what we've heard, tend to be considerably easier and quicker to use in terms of the point of care. And we know that there's a pilot project currently going on within the state where they're using these Abbott Now device or Abbott Now cards to do daily testing. That's happening throughout the county or throughout the state. And so these have become much more, I think our understanding is that they're, that the lack of, 100% efficacy, a lot of that can be resolved with a proper training on how to read the actual cards. And once folks have been in service on how to read those cards and perform the test, we're finding much less false positives and false negatives as a result of that. So my hope is that that offers you some ability to kind of mitigate the testing things. And I know there's been a ton of questions about testing and what testing is going to look like after we go through the vaccination process. At least in the interim, we don't foresee that that changing very quickly. And I just want you to think about, when we think about when we're going to wind these down after we get folks vaccinated, it's there's not a real process for when we convert to recovery. And it's going to be more of a kind of an individual county basis is my guess. I don't think there's going to be a wide stroke of the pen and just say, okay, from now on, everything's good. I think we're going to have this kind of slow decision making to remove these infection control and infection prevention measures. That includes things like screening and temperature checks and all that stuff. So we anticipate that those things are going to stay static for a while. And frankly, it's probably going to be a slow process to remove those interventions until we have a really good or until the state has a really good indication of how effective the vaccine has become. So, and then for Los Angeles County, the state has moved to this Cal OES login for Salesforce to order resources. In Los Angeles specifically, if you're in the county of Los Angeles, they have asked all the facilities to not use the Cal OES process and to continue to use your normal process to order supplies through Los Angeles. And if you download that MOOC contact list, you'll see the name Kathy Chichester listed as the MOOC. She's definitely not the person to contact. Don't email her directly and ask for supplies. or if you do, make sure it's only after you have exhausted all of the other stuff. So I get not nasty emails, but I get emails from Kathy quite frequently about folks reaching out to her directly. So please, if you can, go through the process first before reaching out to the director to her email. All right, so that's the testing constraints. I'm sorry, guys. I wish I had a magic bullet to get you out of this and to get more capacity, but this is going to be tight for a couple more months, I think, and then we can forecast maybe some relief in a few months from now. So I want to talk for a second about surge. The Department of Public Health issued an AFL 2091 that talks about something called crisis standards of care. And crisis standards of care are generally what any hospital or any healthcare facility would institute when they have a scarce allocation of resources, and they have to divide up those resources um, uh, based on the prognosis of the person and the people that are sick. And what we're seeing in Los Angeles, and my hope is this does not expand to areas outside of Southern California, but if it does, I want folks to be prepared. We have a number of tools to deal with crisis standards of care and things of that nature. But when we talk about the hospitals converting to crisis standards of care, even though that does not necessarily have any impact on how we provide care in our settings, what it does do is it really kind of limits our ability to send really sick folks to the hospital. And in Los Angeles's case, they want skilled nursing facilities to proactively identify those residents that have a poor prognosis for survival or are on hospice care that need acute services. They may not have a place at a hospital, and they may be asked for you to hold on to that resident until they pass away. So it's important, even though the hospitals are doing their thing, the downstream impact to us means that we may not have that ability to move those acutely ill people to a hospital. If that's the case, you got to make sure you understand how to take care of mass fatalities. If you have a multitude of people that pass away and you're not able to get mortuary service or somebody to pick up the expired residents, you're going to have to figure out a way to store those bodies and house them until folks can come pick them up. And so within the handout today, I know folks have asked for this. We've included our mass fatality planning guide. Walks you around, how to store bodies, how to identify them, what kind of PPE should be used, where you should put these folks, things of that nature. A lot of stuff that we wouldn't necessarily normally think about. And our mass fatality plan is more of a generic mass fatality plan. It could be applicable to a large earthquake where a portion of the building collapsed, or it could be something from a pandemic or something or what we're currently facing. So it will need to be customized just a tad bit for your specific building, but definitely I wanted to make that available. I know folks have reached out and asked for that because they've had issues with getting mortuaries to come pick up the bodies. So really, really not good news. Sadly, I don't think the problem in Los Angeles County is going to get any better. What we will say that I've heard that a number of owners and large corporations within the county have reached out directly to public health to offer open beds and things of that nature. So if you're in Los Angeles County and you have capacity and space to take care of folks, whether it's COVID positive people, whether it's COVID negative people, whether it's COVID exposed or yellow zone, anybody that you have the capacity to take care of, I think you or your corporate folks should reach out to Dr. Gounder or Dr. Rubin or Dr. Nichols from Los Angeles Public Health from the ACDC unit and let them know, because the problem at the acute hospitals is severely bad right now. And whatever we can do to help relieve that without representing a risk to our existing residents, we want to do that. And so if you feel confident that you have the capability of doing that, this is a way to restore your census, to get folks back in the building and start doing what we do, and that's provide care and help people get back home. So I want you guys to really be proactive and do that. I can't tell you how much those folks at ACDC appreciate you participating and playing a part in relieving the surge on the county. It's incredibly bad, and I hear just the stress and the pain in those doctors' voices when they talk about all the things that we have to do. Not good stuff. So if you have the capacity to help, gosh, I say, reach out, tell them, look, we've got 6 beds or 4 beds or 20 beds. I've got staff to take care of, 4 people, whatever it is. If we have an olive branch to hand out to those folks, we definitely want to do that. And that doesn't apply to Los Angeles. If you're in other parts of the state and surge is an issue in your hospitals, and you feel like you have capacity and you have good infection control and infection prevention measures, reach out and say, yes, I can help. I want to be a part of this continuum, and I want to do that. But if you don't feel confident that you can keep your residents safe, if you're staffing a skeleton crew and really folks are not getting enough attention, then maybe for you it's better that you stay the way you are. But if you do have capacity, I want, after this is over, I want our partners in public health and the hospitals to say that we did our part to help. And I think this is going to be one of those opportunities where we have the ability to really assist not just our healthcare partners, but the community at large as well. So hopefully you guys have the capacity to be able to do that. If you have questions about surge capacity or setting up any of those cohort zones, by now I think you probably could teach a class on doing that. But if you have any questions, feel free to reach out to me, and I'm be happy to go over that stuff with you. All right, so let's talk about vaccine, and we'll talk about the logistical stuff, because I know that is a huge area of concern for most folks. Obviously, the communication with both of these companies has been intermittent. For some folks, you've had very pleasant experiences and they've contacted you in a timely manner, and they've done the 2 calls and you've already set up your 3 clinics. And then some folks who said, I got a note that said I was canceled and I was rescheduled and nobody called me, and I've not been able to get a hold of anybody else. And that is, so we have this huge disparity between folks that are getting no service versus folks that are seem to be flying through the process. And so one of the things we've asked was, well, gosh, how do we contact these folks to verify where we are in the process? And I have not had very good luck getting a specific phone number. And I'm assuming that's because there's tens of thousands of people that would overwhelm this phone number trying to get information. I do know that once you have a contact and you are connected with somebody, that seems to be kind of resolving itself as you go along. But if you've not received any contact from CVS or Walgreens, we need to know about that, because we have to pass that information to the state and say, listen, we've got to hold CVS and Walgreens to the fire and make sure that they do a better job at this. I'll say, and I've said this, and I've told people this for many months, I do think it's probably going to be until February, until we can get all the buildings through the first 2 clinics. And I think the ICF facilities will probably not see theirs complete at the very earliest until the end of February. So I think we have this assumption that there's this massive cadre of nurses and pharmacists that are out there waiting to vaccinate people. And the reason why the rollout has been slow is not because of anything other than this is a really time-consuming process, and they just don't have the staff resources to be able to do it as quickly as we would like to have it done. And so if you're connected with either one of those partners, those are the contact websites and the webinars that they've offered. I want to say that the counties can supplement this program. So most of the counties, except for Los Angeles, opted into the program. But by opting into the program does not necessarily mean that it excludes you or your staff from accessing the COVID-19 vaccine through the county supply. And we do know that in many counties, not all counties, but in some counties, the counties themselves have made it a priority to make sure that all healthcare workers get vaccinated. Santa Clara is like that, where they have drive-in clinics. Marin did something like that. Mariposa did something like that. Alameda is doing something like that. So we have a lot of instances where counties are supplementing the CVS and Walgreens program. And I will say, if you don't have a clinic set up, or your clinic is really far in advance, and especially if your county is suffering a surge, it just makes sense that the folks in your building are most likely to end up in a hospital, most likely to have negative health outcomes from catching COVID. So we want to vaccinate them the quickest, because they're the folks that are most likely to exacerbate the surge at the hospitals. And those are the folks that are going to be the first people that they withhold resources from at a hospital. So we understand, and we want health departments, and this is going to be your direct advocacy. I know of many providers that have called their health officer and said, look, you've got us in tier 1A, our staff are in tier 1A, our residents are in tier 1A. CVS is not going to be here until January 26th. I want everybody vaccinated beforehand. Is there any way you can help me out? Are there clinics I can send my staff to? Things like that. I want you guys to at least be a squeaky wheel and make sure, because I promise you, I sit on all these vaccine committees about how the vaccine is going to be distributed after this. And if you think there are a lot of people at the table asking for vaccines now, the folks that are after us are all banging down the door to get this vaccine. And if we don't make sure that folks keep their eyes on the prize at our local health department, we will see those sub-prioritization folks that are lower on the tiers getting vaccines before our staff and our residents. And wasn't the goal of the state. It's not the goal of the CVS and Walgreens program. The whole reason those folks are in tier 1A is because it's a priority to get them vaccinated. It's two separate things. They're most at risk for contracting it, and they're most at risk for negative health outcomes. So those are the arguments you kind of pose to your health officer to ask if you want to be moved up, or you want some other accommodation. So CDPH has that allocation guidelines. It's linked there on the bottom. But persons exposed through work in healthcare or long-term care settings, these are tier 1A, meaning they're the top of the top, right along with the acute care hospital folks that are dealing with the surge. Now, there are some folks that work in our settings that necessarily would not be in tier 1A based on the type of work they do within the facility. If you have staff that are remote, like me, I work remotely. I'm not in that setting, even though I would technically be called an essential worker. Because I work remotely, I'm not a part of that sub-prioritization. So within that guideline, it breaks down, kind of people who work resident or patient facing, and those kind of support roles. And then it goes all the way down to individuals like myself who work remotely. So take a look at that information, and you'll see that quite a bit, if not most of the folks that come into your building every day are included in the SNF staff and tier 1A. The counties have varying capacity. There is a state website. I didn't list it here, but it shows, what each county has received in terms of the Pfizer vaccine and the Moderna vaccine. And then the county should have a list of that. Some of them have it publicly available where you can go check and see where things are. But definitely we've seen even in Los Angeles, they're starting to vaccinate people in that second tier before they've gotten through the first tier 1A. All right, so in terms of preparing for the arrival of CVS and Walgreens, and this would apply to doing your own clinic. If you've received all of the vaccine from Los Angeles County, this would apply as well. even if you are having Curative come out and do your clinic for you in Los Angeles County, you're still going to need to do kind of all of this stuff to prepare for their arrival. And that will help make the clinic go as smoothly as possible. There's going to be, we kind of divide things up into three little buckets. You know, what are the staff that we need to be able to do it? What's the stuff that we need to be able to do it? And what's the space where we're going to do it at? We have a template on how to do a clinic that is included in the handouts here. I just want to talk for a second about kind of the components that go into that. So when we talk about, you know, staff, we want to have a designated point of contact, somebody they know that's their responsibility and they're designated. They're going to be our point of contact with the pharmacies. We're going to have that in writing. We're going to put that on our plan. We're going to write down our pharmacy partner. That's going to be identified. We're going to identify the facility nurses that are going to assist with the clinic. When we talk about space, we need a well-ventilated area. We need to have 6 feet physical distancing. We need source control for both staff and residents getting vaccinated. And then what you should be doing is going through your facility and identifying residents that need bedside vaccination. So if you've not already done that, make sure you quantify, you know, who's going to come to the area where they're going to get vaccinated and who's going to need it in their room. And then discuss these space requirements with your pharmacy partner, whether it's CVS, Walgreens, or Curative. You want to confirm with them that what supplies are needed. We've heard in some cases they've asked for supplies like tables and chairs to be set up. That's completely understandable. Nobody wants to stand while they're doing all their work all day long. So those are all good things. What we want to collect from folks and make sure we have this ready and available is the insurance information for both staff and residents. We need to make sure that we have their Medicare card, a current Medicare card, so you definitely have that. We want to make sure that we have documented who their primary care physician is, and we want to make sure all the consent forms are completed. And if there's one thing, one glaring point from CVS Walgreens and all the facilities that we've talked to that have done their first round of clinics already, is these consent forms are the main barrier and the main holdup to timely completion of these clinics within the buildings. So, all right, and then we want to identify who's going to oversee collection of resident consent forms, have that person identified, make sure they obtain copies of the pharmacy consent forms. If you're using the CVS and Walgreens, they have specific consent forms they want done. And you'll need to get the FDA EUA fact sheet. So you're gonna, for Los Angeles County, you're gonna make sure you get the Moderna fact sheet for the remainder of the state, unless you go through the county and they allocate some Moderna. But in any case, you're going to have one of those two EUAs to hand out. Identify which residents, obviously, that can sign consents themselves and go through that. Identify who needs a healthcare proxy and work through that process. And then create a tracking sheet for residents and staff. So we need to be able to tell who's received, who you received consent from, who has agreed or declined, and then make sure we keep those consent forms to give them to the CVS and Walgreens. Let's see here. What else? What other kind of stuff do we need to do? So I think that's kind of the main stuff. The real drawback has been these consent forms. So when we look at the common themes of delays, I don't know, in some instances, it sounds like a self-inflicted wound where a facility may not have completed the forms correctly. But in many cases, we're finding that the CVS or Walgreens database is incomplete. And it may be missing information that we have already submitted. And that will need to be redone at the facility during the clinic. And so that's going to add a considerable amount of time to the amount of time it takes to do the clinic. So we keep those consent forms to make sure that we have them there in case their files are incomplete and have them ready to go. If you don't have a current Medicare card for a resident, We've been told that they can input a social security number into the system and it should be able to pull them up by their social security number. We've also heard that ongoing outbreaks have been a barrier to facilitating the clinic because they don't have appropriate staff to be able to dedicate to do all those things we just listed to support the clinic. In that case, where you're completely unable to pull off a clinic because of an ongoing outbreak, one, we want to reschedule as quickly as we possibly can. Two, we want to try to get emergency staff in there so that we can run that clinic if possible. Many folks have asked about, what do we do with previously positive and all, folks that have already or are currently on currently positive. What do we do with those folks? And there's not concrete guidance in terms of when you should or should not. They say that after you've been removed from transmission-based precautions, if you've had COVID, you're okay to get the vaccine. And in our settings, I actually think that's what we would want to do. Now, it does say that in light of vaccine shortages, that we may consider postponing that until 90 days have passed. But in our settings, that's not something I would necessarily recommend. I don't think that there has been any data that shows that the person would have less protection by getting the vaccine, shortly after they had resolved their infection. I just don't think there's any data that shows that. So with that being said, it's going to be easier, and from a holistic protection of the entire building perspective, we want to make sure to get as many people vaccinated as quickly as we possibly can. And one of the last common themes is it's an issue. It's not really a delay, it's wastage. And so when CVS and Walgreens or Curative or even with your own clinic in Los Angeles, you may have the assumption that a certain number of people, or the clinics have a certain assumption that there's going to be 100 and let's say 150 staff or 150 total people being vaccinated at your facility, and they get there and they bring enough to basically meet that need, and then you have 15 staff decline at the time. Well, those 15 doses cannot be put back in the refrigerator. They have to be used. And there's been some guidance and suggestions and some kind of intimation that you should be, prioritizing those overage dosage. Now, if you're with CVS and Walgreens, if it's enough, I think they will pivot and they'll call a facility that's close within your area to see if they can get folks vaccinated. And we've had examples of that. We've also had other examples where it was 1 or 2 doses. And what to do with that. Now, I try not to ask those questions about things like that, but I just want you to know if you're not following the prioritization list that CDPH has issued in terms of what to do with overage for these vaccines. They released the KHAN last night that kind of talked about how to do that. I would just be very careful. I don't know that you would necessarily get identified for putting somebody ahead of somebody else, but it's not a good public perception thing if your personal families are now receiving vaccines and they're not on that prioritization list. Things like that, we have to be very careful with the message that we've seen, and we want to be seen as equitable in making sure that the folks that are most at risk get the vaccine first. We expect there to be an AFL forthcoming about what to do with overage and how to prioritize that. We just don't know legally whether you would be allowed to vaccinate folks when they're not under your care. And we have concerns about whether that's allowable or whether that exposes you to any liability risk. So we're we're going to have conversations with CDPH, and we've already expressed our concerns about telling folks to use any vaccine to vaccinate folks that are not our residents or staff. So we expect that to probably drop pretty soon, maybe within the next few days, maybe next week is my guess. So, and then some of the common themes of successes, because there have been a lot of successes within our buildings where we've had a good number of staff and residents identify they wanted to be vaccinated, and when the time came, they actually went through with that. We've got a lot of those really, really successful stories. But that starts with the communication with staff and residents beforehand. It's weeks or maybe even months as a buildup, to the vaccination coming to the building. All of the folks that were successful and ran their clinic smoothly had their consent forms complete and verified the completion from CVS and Walgreens prior to their arrival, and then adequate staff to support operations. And we know that's going to be a challenge for you guys for sure. And I want to just mention this one last theme of success. And I've talked to a number of people, and while it's not been particularly smooth in a lot of instances, the one great thing that I've heard is I've not heard anybody, including all the people I know that have taken the vaccine already so far, talk about adverse outcomes, including even mild or moderate symptoms. So as we see this expand, we're seeing even less kind of impact from the first vaccine than we had originally anticipated, and certainly given what we thought from the EUA. It's actually a lower percentage, is my understanding, than what was cited in the EUA. So those are great news. Obviously, we'll hear of really poor outcomes, but what we don't hear of the hundreds of thousands, if not millions at this point, of successes given this vaccine. So that's very important to know. It's also very comforting that your arm's not going to fall off tomorrow if you get your vaccine today. All right, so those are kind of the logistical things, and how this ties into vaccine communication strategies is, I really think we've got to think about how we communicate with our staff to encourage them to get the vaccine. And I know a lot of folks are scared. They're really scared that this has been rushed, that they can't really identify what the long-term impacts of taking the vaccine are. A lot of those are very valid things, and even folks, very smart people that I've talked to, physicians and medical directors, all have concerns, and rightfully so. Me personally, I've read all the data, and I think not only is it incredibly safe, I think it's incredibly effective, which is even more important almost, but we want to make sure that folks aren't going to get sick, and I think at this point we've got a pretty clear idea of that happening. But you're going to have folks that have maybe not really heard that message, and maybe us as administrators or DONs or IPs, and maybe we aren't the ones to carry that message. We've had a lot of suggestions about successful engagement being brought by staff leaders. So your CNA leaders, your RN leaders, your housekeeping leaders, your maintenance staff leaders, folks that are leaders within your building and not necessarily a part of your administrative structure, to help carry the message. We want them to promote the vaccine. We want them to support the vaccine's delivery, and we want them to demonstrate personal demonstration of those folks getting the vaccine. So if you've got those folks and you've identified them, we want to definitely kind of push them to promote that and encourage them to do that. We need to dedicate time at regular staff meetings and other regular occurring stand-ups, things like that. Even if it's remote, A portion of every meeting should be talking about making sure that we get 100% of the building vaccinated. And that should be our goal. Our goal shouldn't be 70%. It should be everybody in the building that is able to, and it's not contraindicated for, we want them to take the vaccine. Provide information on safety and efficacy. I know that social media is full and ripe with information, some of it good, some of it not good. I say, let's keep the information to those which talk about safety and efficacy, and not something that's subject to personal experience. We want to poll staff to find out what's the root cause of why do they have concerns? What is their what are the things that make them scared or hesitant to do this, and how and utilize a cooperative type process to improve confidence. Identify a work group, try to set goals, and really target improvement in making sure folks get vaccinated in your building. Keep communicating with them, even if you get a no. I can't tell you how many people have run their first clinic, and then all of those people that said no 4 or 5 days after that first clinic go, okay, now where can I get mine? Because they saw that none of their staff, none of their fellow workers got sick, and they're like, oh man, I should have got it. And now you got to wait. You got to wait till our next clinic, and hope we're not in an outbreak, and hope we can make do with that clinic and we can get you in there. So one of the messages we want to tell our folks is this is the best vaccine that we know of. We may not get an opportunity to give you this vaccine again. You may get a vaccine that's not as efficacious, or that has worse side effects. We don't know, or has long-term impacts. We don't know that. We know this one is pretty safe. And right now, we know that coronavirus or COVID has killed 350,000 people and counting, and this vaccine has killed 0 so far. So we know pretty equivocally that this will help us. It's not a silver bullet, but it will definitely help us. And lastly, we want to make this a big deal. I want you guys to know that literally tens of thousands of people worked countless hours over the last year to make sure that little tiny vial made it to your door. Celebrate its arrival. Create a hashtag, get vaccinated. I don't know if you're a Twitter user or you have your staff is on Twitter, but get them to start doing that, celebrating its arrival. I mean, I would have big banners out there and balloons, and it would be a big deal in my building if it was me. And hopefully you guys find that same thing and you're celebrating that. All right, so in terms of the vaccine update, roughly in Los Angeles, roughly 60% of the buildings, I'm not sure if they have received the vaccine or have completed the registration process, but I talked to Dr. Gounder last night, and that was the rough number he gave us, about 220 to 240. And we do know that for a smaller subset, maybe 60 to 80 buildings within Los Angeles have been assigned to a company called Curative. Curative did the testing sites throughout the county, and now they're pivoting to doing vaccination clinics on site with facilities. They're authorized by LA County Department of Public Health, and they're going to attempt to provide a similar end-to-end solution as CVS and Walgreens. There's a checklist that you need to do to prepare for that. Most of you guys in Los Angeles, hopefully you're aware of that stuff. We had originally talked about engaging long-term pharmacies and pharmacy consultants to help with the first initial distribution, but I don't know that most of the long-term care pharmacies had registered with COVID Ready, and that's a precursor to being able to get authorized to distribute the vaccine. And Los Angeles County did not make us aware of having the pharmacies need to register with COVID Ready prior to this. But for now, if you have a long-term care pharmacy partner, and you're in Los Angeles, you want them to assist with the second dose and any future doses after that. This applies to any long-term care pharmacy in the state. So even if you're not in Los Angeles, I fully expect after CVS and Walgreens is done, they get done with their 3 clinics, we're going to still need to give out vaccinations. So Have your long-term care pharmacy go through the process of getting signed up with COVID Ready. Actually, I take that back. COVID Ready, the last day to sign up was yesterday. Beginning Monday, the 11th, there will be a new website called CalVax, and that's going to take the place of COVID Ready. If you've already signed up through COVID Ready, you'll get your information rolled automatically into CalVax. But if your long-term care pharmacy hasn't registered with COVID Ready, tell them to wait, and then on Monday, go in and register with CalVax. Los Angeles County has daily office hours calls 7 days a week on Microsoft Teams. You can ask detailed, very specific information of the physicians at the ACDC unit. So if you're not participating in that and you have clinical or other vaccine-related questions, by all means, get on that call. It's 9 to 9:30 every day. And then for folks in the county, you should be getting a survey to gauge where you are in the process. If you've not received this already, check your inbox, because it was a kind of a nasty note saying there's a public health order that you were required to vaccinate your staff and residents, and you need to fill out the survey immediately to help us gauge where you are in the process. So I just want to make sure you're aware of that. I know about most of the facilities have already responded to that survey, but if you've not, please address it as soon as possible. All right, and two last pages with some of those guides that you can share with your staff and residents. And as well as AHCA, our national association, has a ton of really, really good information about how to have discussions with your staff and residents about getting the vaccine and things like that. So I'm going to hop to questions, and then if we run out of questions, you might get some free time again today. So, all right. So first question, is vaccine mandatory for the residents? And no, the vaccine is not mandatory for anybody. We don't even think they can make the vaccine mandatory since it was developed under emergency use authorization. I'm not sure that the state or the federal government could mandate a vaccine. We've had a lot of discussions about whether you could make a vaccine a condition of employment. And I'm not an employment attorney, and I will highly recommend that you contact whoever you do for employment law and talk to them about, you know, if I make this as a condition of employment, what are my risks associated with this? I feel very strongly that you know, once you get through your first clinic and the folks that were hesitant really identified that they want to be in at least the second or subsequent clinics, I think we'll find that we'll get a lot of people like that. But there's going to be people that just say no, and I don't know if now's the time to pick the fight and say, you know, either you take the shot or you leave, especially if we've got an acute problem with staffing in our building. So that's really going to be an individual facility. My hope is that you have a great relationship with all your staff, but I mean, heck, you could be a new administrator and came in 2 months before the coronavirus, and the folks on your staff don't actually know you, you know, and if that's the case, you really have to pivot to those internal staff leaders and engage them. And if they're hesitant, ask, you know, do a root cause analysis, find out why are you scared? You should be aware of how this is done. So, and effects of COVID vaccine, next question, sorry, effects of COVID vaccine on giving other tests, the TB skin test, lab test, influenza. You know, Dr. Steinberg, Carl Steinberg from CalTCM sent me a kind of a guide. I have not put it out, but I do know that the CDC has very, you know, specific allowances and contraindications. I shared those on the slide, the webinar right before, is it 21st? I think it was, whatever the Thursday was before the Christmas holiday break. We presented that information, and I can gather it. Is it Vivian? If you can put your email address in the chat, nobody can see the chat except for me. If you put the email address in the chat, I'll send you the contraindications that talks about the TB skin test and stuff like that. So, all right. Well, guys, we don't have any other questions. I don't know what it. Oh, you guys all waited till the last minute to start asking them. Okay. All right. Any indication how we procure vaccine supply after we've completed CVS and Walgreens? And that's a great question. That came from Noah Garrett. Noah, thank you for that wonderful question. We don't know. That's that's the short of it. CVS and Walgreens, once they're done with the sniffs, they basically go from 1,000 or 800 sniffs in our state that they're doing to about 15,000 other long-term care facilities within the state. So it's an incredible, they're just going to, once they're done with us, they've got lots of other things that they're committed to. So we know that it's not going to be CVS and Walgreens. And our assumption is it's going to be the long-term care pharmacies through your normal pharmacy ordering process. But that's going to require your long-term care pharmacy to go onto CalVax or COVID Ready and make sure that they're already assigned that. I would if you're not already signed with them, whoever your long-term care pharmacy is, I would say, hey, are you guys signed up with COVID Ready or CalVax yet? If not, start on Monday, go into CalVax and get set up, because it does take a couple weeks to get approved to be a dispenser of vaccination. So, and they're going to have to talk about their storage capacities and all those other things that they're going to need to complete. And that'll identify whether they could take the Pfizer virus, whether they could take the Moderna virus or any other, or not virus, Pfizer vaccine and a Moderna vaccine, because each of them has storage requirements that are slightly different. So we anticipate that's the way it's going to roll out. But that's going to be highly dependent on how effective the CVS and Walgreens program is. If the CVS and Walgreens program comes in and we only get 40% of our staff done, then we're going to have to look at something equally as large to be able to really increase that number to a much higher percentage. So, all right. So now we got to the last question. And okay, Vivian, I will send you that information very quickly here. And for the rest of you guys, I want to say thank you. The next few weeks are going to be a challenge with both surge and scheduling our clinics and getting those things done. I know you guys are going to be insanely busy for the next few weeks, but I will say that if we can do this and we can do this successfully, there's an end to this, and really we can band together and do this. But the quicker we get those vaccinations in and in our buildings, in our staff's arms, in our residents' arms, in our arms, in our contractors' arms, in our family members' arms, the quicker we can do this, the quicker we can get back to what we do best, and that's take care of people, and instead of doing infection prevention stuff. So I want to thank you guys. I know you're insanely tired. It's just a long drawn out thing, but I want you to know that local health departments, David Farrell, who's with the Alameda County, wanted to let folks know that if you want, local health departments can also help get your pharmacy partner COVID Ready applications approved if we need to do that. So with that, I want to say thank you guys. Have a great afternoon. Hopefully your weekend is somewhat relaxing. Try to take care. And if you need any assistance, don't hesitate to reach out. Take care, guys. Have a great weekend.